All right, let's dive right in. When you're working in healthcare, getting the medication dose right is, well, it's everything, especially when you're dealing with liquids. Today, we're going to nail down the one skill that ensures you get it right with accuracy and keep your patients safe every single time. Let's get to it.
So this is the big one, right? This is the question that pops up again and again. It doesn't matter if you're a student or a seasoned pro, this calculation has got to be like breathing. This is the core challenge we're here to solve today.
So, how do we tackle that question with 100% confidence every time? Well, we use this really powerful tool called dimensional analysis. Honestly, you should think of this as your secret weapon. It's a method that doesn't just get you to the right answer. It actually proves your answer is correct by making sure all the units line up and cancel out perfectly.
Okay, enough talk. Let's see this formula in action. I'm going to walk you through the very first problem step by step so you can see exactly how it works. Here it is, our roadmap, just 4 simple steps. First, you start with the dose the provider ordered. Easy enough. Second, you multiply it by the concentration. You know, what you actually have on hand. Third, and this is the magic part, you cancel out the matching units. And finally, you just do the math. That's really it.
Okay, let's get real with a practice problem. The order is for 250 milligrams. What we have on hand is a bottle that says it has 500 milligrams in every 5 milliliters. So we just plug it into our formula. The ordered dose, 250 milligrams, multiplied by the concentration, which is 5 milliliters over 500 milligrams.
And here comes the most satisfying part, honestly. See how we have milligrams on the top and milligrams on the bottom? They just, poof, cancel each other out. This is how you know your setup is right, because the only unit left standing is milliliters, which is exactly what we were trying to find. So we do the simple math, 250 times 5, then divide that by 500, and what do we get? Boom, 2.5 milliliters. See? Simple, clean, and you know it's right.
All right, you've seen me do it, now it's your turn. Seriously, this practice is what builds that muscle memory so you can do this quickly and confidently when it counts. Let's get to the next problem.
Okay, here's your first scenario. The order is for 30 milligrams of phenobarbital. The supply you have is 120 milligrams per 5 milliliters. So, how many milliliters are you going to give? Go ahead, hit that pause button and work it out. We'll be right here when you're ready to check your answer.
All right, you're back. Let's check your work. The correct setup is 30 milligrams times the 5 milliliters over 120 milligrams. The milligrams cancel out, and the final answer is 1.25 milliliters. If you got that, you nailed it. Great job. Let's not stop there. We're on a roll. Next up, an order for 100 milligrams of ibuprofen. The bottle you grab is 200 milligrams per 10 milliliters. What's the dose? You know the drill. Pause here and give this one a shot.
Okay, let's see the solution. You should have 100 milligrams times 10 milliliters over 200 milligrams, which gives us a final dose of 5 milliliters. You see that? The pattern just works every single time.
Okay, one more to really lock this in. The order calls for 320 milligrams of acetaminophen. The bottle is labeled 160 milligrams per 5 milliliters. Let's do this.
You know what to do. Pause the explainer one last time and solve it.
And the answer is 10 milliliters. The setup is 320 milligrams times 5 milliliters over 160 milligrams. Fantastic work. See, you've totally got this.
Okay, so you've absolutely nailed the how. But now, let's talk about the why, because this is so much more than just a math problem. This is a fundamental piece of patient safety. See, by forcing you to cancel out those units, dimensional analysis is basically your built-in safety net. It makes it almost impossible to mix up your units or set up the problem the wrong way. It's like a little guardrail that keeps you from making those simple but potentially dangerous dosing errors. And while we're on the topic of safety, we have to talk about rounding. The rule here is super simple, but it is absolutely non-negotiable. For liquid meds, you always round to the nearest tenth. But, and this is the important part, you only do it at the very end. Never, ever round your numbers in the middle of the problem. That's how small mistakes can turn into big ones.
Because at the end of the day, it all comes down to this: the right dose, the right way, for the right patient. Every single calculation is about living up to the trust our patients have in us. A reliable method like this isn't about passing a test. It's about protecting our patients. Because in our world, accuracy isn't just a goal. It's the absolute cornerstone of safety.
All right, welcome everyone. Let's get right into a quick dosage calculation workout. Today, we're going to master oral tablet calculations. Think of this as a quick training session, to really build up that critical clinical muscle memory. Every single time you're about to administer an oral med, it all comes down to this one simple question, right? How many tablets should I give? Our goal today is to make answering that question totally second nature, so you can do it safely and confidently every single time. So, what's the tool we're going to use for this? Well, it's called dimensional analysis. And look, don't let that fancy name scare you off. It's really just the safest, most reliable way to solve these problems. It's not some kind of math trick, it's a totally foolproof system. I mean, scientists and engineers use it all the time. And it basically lets the units themselves guide you straight to the right answer. And check this out. The core formula is incredibly simple. It's really just 2 steps. First, we start with the dose the provider ordered, what the patient actually needs. Then we just multiply that by what's available, what we have on hand. That is it. What's ordered times what's available. So why does this work so well? Well, there are 3 awesome reasons. First, and this is the magic right here, the units, like milligrams, they just cancel each other out, leaving you with your answer in tablets. It's perfect. Second, there's absolutely no guessing. It's just a straight-up logical process. And third, you don't have to memorize a ton of different formulas. This one method, it works for everything. Okay, that's enough talk. Let's solve one together. We'll do a guided rep with a digoxin problem. Okay, so here's the situation. The provider's order is for digoxin 0.375 milligrams. We go to the med cart, and what do we find? We've got digoxin tablets that are 0.25 milligrams each. So we've got our ordered and our available. Now let's plug this into our formula. We start with what was ordered, 0.375 milligrams. Then we multiply it by our what's available fraction, which is 1 tablet over 0.25 milligrams. Now look closely. See how mg is on the top and on the bottom? That's the key. They cancel each other out, which leaves us with just the unit we want, tablets. So when you run the numbers, 0.375 divided by 0.25, what do you get? You get 1.5. The patient needs 1.5 tablets of digoxin. See how that works? It's simple, it's safe, and it's accurate. All right, your turn. Time for a challenge. Let's test your skills with a few rapid-fire problems. Okay, problem number 1. The order is for metoprolol 25 milligrams. What you have available are 50 milligram tablets. How many are you going to give? Go ahead and hit pause and solve this one. We'll be right here. All right, you're back. Did your setup look like this? It should be 25 milligrams times 1 tablet over 50 milligrams. And that gives you 0.5, just half a tablet. Awesome job. Ready for the next one? Okay, here's problem number 2. The order is for ergocalciferol, 225,000 units, and the tablets you have on hand are 50,000 units each. Now, don't let the big numbers or the different unit fool you. The process is exactly the same. You know what to do. Hit pause and run the calculation. Okay, let's see how you did. Your setup should look just like this. 225,000 units times 1 tablet over 50,000 units. And again, those units cancel out perfectly. Which brings us to a final answer of 4.5 tablets. 4.5. You're getting the hang of this. Let's do one more to really lock it in. All right, last one in the challenge round. The doctor ordered warfarin 7.5 milligrams, and you've got 5 milligram tablets in your hand. Okay, one last time, pause here, work it out, and let's see what you get. And here's the setup. 7.5 milligrams times our good old fraction, 1 tablet over 5 milligrams. And the answer is 1.5 tablets. 1.5. Fantastic job. You nailed that challenge and you've used that core formula perfectly every single time. Okay, great workout. Now it's time for the cool down, but this part is maybe the most important. We're going to cover 2 absolutely critical safety rules you have to know. And listen, this is a big one. It's non-negotiable. If a tablet has that little line down the middle, if it's scored, that means it's designed to be split so you can safely give half a tablet. But, and this is crucial, if the tablet is not scored, you can't split it, period. You can't round the dose. You have to call the provider or pharmacy to get it clarified. This is a huge patient safety check. So why does mastering this one thing matter so much? Because everything we just did, it all comes down to building one single skill: converting an ordered dose into the right number of tablets. Once you get that down, once it becomes automatic, you're going to find that all the more complex stuff, I'm talking liquid meds, IV dosing, it all gets so much easier. You just built a foundation. The real question is, what are you going to build on top of it? Hey, welcome. Today, we're jumping into a skill that is absolutely critical for anyone who administers medication: unit conversions. And let me tell you, getting this right isn't just about passing a test. It is a non-negotiable part of keeping your patients safe. So we're starting here because, honestly, this is where so many medication errors begin. You've got a doctor's order in one unit, and the drug you have in your hand is in a totally different one. This happens all the time. Our goal today is to give you one core skill to handle this situation safely, every single time. Before you even think about picking up a calculator, before any numbers get crunched, this is it. This is the first, and I mean the most, important question you have to ask yourself. Are the units I'm working with compatible? If the order is in grams and the tablets are in milligrams, the answer right out of the gate is no. And this is exactly why that first question is so important. You could do the calculation perfectly, right? Divide everything correctly, feel super confident in your answer. But if you skipped that initial unit check, your correct math is going to lead to a dangerously wrong dose. This is probably the single biggest trap in all of med math. So, how do we dodge that trap? Well, it all comes down to one simple, really powerful principle. Let's just call it the golden rule of dosage calculation. And here it is. This is your non-negotiable first step. Think of it like a safety check. Before you calculate, you convert. You have to make sure you're comparing apples to apples. Grams have to be turned into grams or milligrams into milligrams. There is absolutely no other safe way to start. Now, the good news is that the conversions you'll use most of the time are pretty simple. You're almost always just working with multiples of 1,000. As you can see, 1 gram is 1,000 milligrams, and 1 milligram is 1,000 micrograms. Seriously, just committing these two facts to memory will get you through the vast majority of conversion problems you're ever going to face. Okay, theory is great and all, but confidence, that comes from actually doing it. So let's work through a few common scenarios together. I'll pop the problem up, you can pause and try to solve it yourself, and then we'll walk through the solutions step by step. Sound good? All right, here's our first one. The order is for 1 gram of erythromycin. You go to the med cart, and the tablets you have are 250 milligrams each. Right away, you can see that mismatch, right? Grams versus milligrams. So what's your first move? Go ahead, hit pause right here, and apply that golden rule we just talked about. Convert first, then solve. We'll be right here when you're done. Okay, you back? Let's break it down. Step 1, the golden rule. We convert. We change that 1 gram into 1,000 milligrams. Boom. Now our units match the tablets. Step 2 is just setting up the problem. We need to give 1,000 milligrams, and each tablet has 250. So step 3 is the easy part. 1,000 divided by 250. Which gives us our final, and more importantly, our correct and safe answer, 4 tablets. See how converting first just makes the final calculation totally straightforward? Let's try another one, just to really lock in that pattern. The order is for 3 grams of acetaminophen. The tablets you have on hand are 500 milligrams each. And again, there it is, that gram to milligram mismatch. You know the drill. Take a moment, hit pause, and work through those steps. Remember, convert first, then figure out how many tablets you need. All right, let's check your work. First, we convert the 3 grams to 3,000 milligrams. Perfect. Now our units are all lined up. Then we set it up. We need to give a total of 3,000 milligrams, and each tablet gives us 500. So we just divide 3,000 by 500. And our answer is 6 tablets. See, the process is exactly the same. The numbers might change, but that crucial safety step, the conversion, that always stays the same. Okay, let's do one last problem. This time, we're throwing a decimal in there, just to make sure the rule still holds up. The order is for 0.5 grams. The tablets are 250 milligrams. Don't let that decimal freak you out. The process is exactly the same. All right, last chance to practice. Hit pause, follow that golden rule, and solve for the final number of tablets. You got this. Let's walk through it. Step 1, convert. zero point 0.5 grams becomes 500 milligrams. And notice how converting first actually got rid of the decimal, making the math even simpler. Step 2, set it up. We need 500 milligrams, and each tablet is 250. Step 3, solve. 500 divided by 250. And the correct answer is 2 tablets. Fantastic. You've just nailed the fundamental pattern for safe unit conversion. Okay, so now that we know the right way to do it, let's talk for just a second about the wrong ways. Because knowing the common pitfalls is just as important as knowing the correct procedure. You know, it's funny, most med-math mistakes aren't really about bad math. They're about a bad process. The number one mistake, hands down, is just forgetting to convert, like just dividing 1 by 250 in our first problem. The other big errors are trying to convert after you solve or converting in the wrong direction. But our golden rule, convert first. It prevents all 3 of these. So why did we spend so much time on this one single skill? Because it's not just a skill, it's the foundation. It's the bedrock for all the other more complex medication calculations you're ever going to do. And this right here shows you exactly why this is so critical. I mean, think about it. You cannot safely figure out pediatric doses, you can't manage IV drips, you can't handle weight-based dosages if you don't first make sure your units are compatible. This isn't just one type of problem. It's the first step in almost every type of dosage problem. Get this right, and you are setting yourself up for success everywhere else. Let's end on this thought. The whole point of practicing skills like this isn't just to pass an exam. It's to turn something that feels really intimidating into simple pattern recognition. When you master these basics, you build a foundation that turns the anxiety of med math into the confidence of a repeatable, safe process. So what's the one question you're always going to ask first?